During delivery, some women experience burning or stinging in the perineum, the diamond-shaped area incorporating the vagina and rectum. This feeling, referred to as the ring of fire, occurs as the vaginal opening is stretched during crowning when the baby's head emerges from the vagina. This burning or stinging is brief. The perineum then becomes numb as vaginal tissue stretches and nerves in the area are blocked. When a woman experiences the ring of fire, she is often advised to stop pushing and focus instead on deep breathing and relaxing the perineal area. A cesarean or C-section means a baby is delivered through an incision in the abdomen rather than through the vagina. The incision is usually horizontal and just above the pubic hairline, but may also be done vertically from the belly button downwards. A C-section may be planned if a problem birth is suspected, or used as an emergency procedure if unexpected problems arise. The baby and placenta are delivered from the uterus, and the incisions are closed with stitches. As with all major surgeries, there are risks with this procedure. During childbirth, an incision may be made in the perineum, the diamond-shaped area that includes the vagina and rectum. This incision, called an episiotomy, used to be routine for vaginal delivery, particularly a first delivery. The incision was thought to reduce potential damage from a natural tear while making repair easier and speeding delivery. An episiotomy is no longer a routine part of childbirth in the United States and is usually done on a case-by-case basis. Before birth, the baby grows and develops in the uterus or womb. The birthing process begins with regular contractions of the uterus and dilation or opening of the cervix, the narrow opening where the uterus joins the vagina. When the cervix is fully dilated at 10 centimeters, around 4 inches, uterine contractions become stronger and more frequent. The baby goes through a series of passive movements, especially the head. Birth stations indicate how low the baby's head can be felt in the mother's pelvis. The baby's head then begins its passage out of the vagina, called crowning. Labor continues as the baby's head and body pass out of the womb and vagina. The home for a developing fetus is the amniotic sac. Entering the birth canal requires leaving the sac. The sac membrane breaks, and the amniotic fluid that filled it, about a quart by the final week of pregnancy, flows out of the vagina. The amniotic sac membrane is thought to help protect the baby's head during labor against the opening cervix. Sometimes the sac membrane breaks naturally when a woman's so-called water breaks, and sometimes the sac is ruptured by the birth attendant. There are 3 stages of labor. Each of these stages varies according to the woman and many other factors. The first stage includes early labor, when the cervix thins, effacement, and begins to open, dilate, from 0 to 3 centimeters. This stage may take hours or days. During active labor, the cervix opens further and contractions become stronger and more frequent. Transition follows with the cervix becoming fully dilated to 10 centimeters, and the second stage of labor begins. Contractions in this stage become stronger as the baby is pushed down the birth canal. The head crowns, is seen from outside, and the baby is finally delivered. The second stage can last minutes to hours. During the third stage, soon after the birth of the baby, the placenta is delivered. The third stage, or placental delivery, usually occurs within 10 minutes of birth. There are different ways to manage pain during labor. One method is a local anesthetic called epidural anesthesia. This method is often patient-controlled. When relief is needed, the woman presses a button. This delivers anesthesia into the epidural space, which is between the bony spinal canal and tough outer covering of the spinal cord. Sometimes the woman can also move around, a so-called walking epidural. Another option, called a spinal epidural, delivers a spinal block and epidural in a single injection. This option can be used far along in labor.
Shoulder dystocia is a rare and serious complication of childbirth. After the baby's head has been delivered, one or both shoulders are stuck and cannot be delivered. Dystocia increases the risk of complications for both the mother and the baby. Multiple maneuvers are employed to resolve the problem.